quick introduction. So, my name is Christabel. I am a nurse and I am also a qualified health visitor. I've been asked a couple of questions recently just regarding how did you do it, what does it take to become a health visitor, just from somebody that I went to nursing school with. So I thought I would just make a quick information sort of video just to kind of give some pointers if there's anybody else who is a nurse and is looking into the same thing, because I'm sure there's probably more than one person out there who's got some questions about it. So here we go. So firstly, I think it would be good to start with this question just because it gives a bit of a background of what a health visitor is. So health visitors are qualified nurses who have specialised in health visiting, which is a specialist public health. I need to start that again. Specialist community public health nurse, otherwise known as a SCPN. So that is what a health visitor is by qualification. And what the job role actually is, you will have a health visitor, or you would have met a health visitor if you've ever had a baby. So we work with children and their families between the ages of birth, 0 to 5 years old, and we support the families just with general health information, supporting parents who are training up their children if they need that support as well, assessing child development at various stages. So at the moment, health visitors work with what we call the Healthy Child Programme, which is the 0 to 5 service, and we do 5 key contacts, which is in the antenatal period, the new birth, which is between 10 and 14 days after birth, and then the 6 to 8 week contact, and then following this we will do the 9 to 12 month development check, and then after that the 2 to 2.5 year development check. And those are our 5 key contacts. Outside of this, we can support parents more often. We offer baby clinics. We also work with nursery nurses who I would say are more specialised in the area of child development in terms of behaviour management and those kind of things. So there is quite a few things we can support parents with. So that is a general summary of what a health visitor does. And if there are any health issues with the children, we monitor them more closely. And also if there are any child protection issues, we also supervise those and we work closely with social services. However, that being said, we are not social services. And just one more time for those who may have missed that, we are not social services. So a lot of people do get scared thinking that, oh my gosh, the health visitor's coming and they're gonna, try and find something wrong with my parenting and, they're gonna take my child off me. It's not the case. We're not health police. We are literally there just looking out for the child's well-being. We also know that there's a lot of information that we give that the majority of people don't take. We walk out the door and we know that people will do what they will do ultimately, and ultimately it is parental choice, but we are there to advise and recommend the best practice basically. So for those of you who are potential candidates, anybody can become a health visitor. When I say anybody, but you first must be a registered nurse or midwife. So any field of nursing and midwifery can then progress. So it is only a postgraduate course. It's not available to be done just as an undergraduate level course. The training is 1 year, which doesn't sound bad, but as we know in nursing, 1 year, it's going to be a long year. Anything to do with the NHS, it's never quick. So yes, 52 very full weeks of very intense training. And I don't mean intense like physically your body is jumping up and down, no. For me personally, I found it a bit of a shock to my system, just simply because I was based in secondary care in the hospital for the majority, since my training really. I didn't really have that community-based experience. So for me, I was used to the fast pace and running around and running left, right and centre, not knowing which way your head was screwed on, that kind of thing. But when it came to health visiting, even in the training, I remember the first week, it was so slow. Very, very slow. I was just a bit like, whew. When do we get up and run? We don't. Okay. So yeah, I had to reset my body clock, reset everything, reset my mind, reset everything. You have to just, if you're not used to that already, then it will be a shock to the system. However, that being said, it's not a sit down, cross your legs type of job. It's still busy, very, very busy, but it's a different kind of busy. You're not, by the end of the day, you're not physically tired, you're mentally tired. So it's still draining. I wouldn't say it's easier. It's just easier in the sense that you're not on your feet for 12 hours. But in terms of the work itself, there's a lot to keep you going. And I'm not even going to pretend that it's easy, because I'm sure they would happily give us more to do if I did say so. But I'm not saying that just because I don't want no more work. Like, it genuinely is a lot already. So yeah. The training in order to do health visiting. So number one, you need to be a registered midwife or nurse. And then after that, in order to qualify for the course, you have to apply for the course as if you're applying for a job. And then, so I applied for mine through NHS Jobs. And then following that, you also have to apply to university. Your university place will not get accepted, as far as I'm aware. It won't get accepted without you being accepted for a job to train. So basically, you have to have a trust that will sponsor you through your training. So that also leads on to the funding of the course. So at the moment, well, I think it works differently in different areas, but the area I trained in, they had funding from Health Education England, I believe, to train students for each year, well, as many years as they supplied it for, basically. So each year they will they will provide money to have students trained into health visiting. So yeah, that's how I got my role. So you apply for that job, they will put as many adverts out as they have availability for, obviously, and then once they take in and they've done the interviews and they find who they feel fits the who passes the interview, basically, then you will automatically be funded for the year. So you will be paid at a top end band 5 salary for the training of the course. So for me, I was quite new into nursing in general, so I'd only been qualified 2 years when I started my health visiting course. That is also a minimum requirement for you to join health visiting, is to be qualified as a nurse for 2 years. Yeah, I had just met that criteria when I started my health visiting. So for me, the pay was an increase because I was still quite low down on the band 5 pay scale, well, near the beginning, because I just qualified as a nurse. So for me, it was a big jump to be paid top end band 5, and then once you qualify as a health visitor, you qualify at band 6. So you will start at bottom end band 6, as far as I'm aware. For those who may be considering it, who are already band 6s or maybe higher bands, and think that obviously that's going to be a bit of a pay drop, it is a pay drop. For those who are coming in from, maybe being a sister or charge nurse or, anything else, a specialist nurse in any area, it will be a pay drop to the top end band 5 if you are already above that. But then I'm not sure if it is an option that maybe when you qualify you can go back to where you were based on your years of service in NHS. Don't quote me on that because I don't know, but it might be something to discuss with your employer. If it is an option, great, but if not, then it may be something that you need to consider if you want to go into health visiting, and if financial circumstances will allow those kind of things. Also, I will add that with the funding for the course, even though I did say you have to be employed by a trust, I do remember speaking to a student on the phone one day who called our trust wanting for a placement place. She did actually say that she was funding herself. I'm not sure how much the course is if you want to do that, and I'm not sure how to go about that because that wasn't what I did. But it is an option for those who would like to look into that. Maybe if your area isn't being funded at that point in time that you would like to go into it. So just so you know that isn't an option, but I think you would also have to inform the university that is your plan as well, because obviously they need to know how you are going to do practice, because it's not optional to do the theory and have no practice, or do the practice and have no theory. The two have to go together. So just so that those of you who would like to go ahead and fund it yourselves, it is an option, but that would be something that would need to be looked into a little bit more. So the training, it was pretty much every week you attended uni and practice. So the way my course was set out, we had a timetable for the year, which there were the occasional full blocks of uni or the occasional full blocks of practice. There are 3 semesters, so your general 3 terms. So from September to the end of January is semester 1, then from February through to about May is semester 2, and then June to August is semester 3. Semester 3 is purely practice. Semester 1 and 2 are where it can vary, but majority of the time you are split between practice and university. So for me, you get 1 study day a week. So Monday, Tuesday were my practice days. Wednesday was a study day, and then Thursday, Friday we were in uni. It is a little bit flexible in the sense that you can rotate your study day if you need to. Obviously life sometimes happens and it's not every time you will need a Wednesday off necessarily, so if you want to have the Monday off, then you go into practice Tuesday, Wednesday, whatever's relevant for you. Just sort it out with your practice teacher. So that is the general outline of the course. It is very intense. The way it was designed, we had two assignments in semester 1, another 2 assignments in semester 2. No, I lie. 3 assignments in semester 1 and then 3 assignments in semester 2, and then there was 1 exam also in semester 2, and then you do prescribing. We are V100 prescribers as a standard. Some health visitors have gone on to then do the V300, which so the difference between that is the V100 allows you to be a community prescriber, so a nurse prescriber, which means that you prescribe only from the nurse's formulary, which is quite small, like this. But if you go on to do the V300, that is the full BNF, like the full book. So you can prescribe like a doctor, more or less, but obviously you prescribe within your limits of the practice. Obviously you're not going to go and prescribe, I don't know, local anesthetic for a crying baby. It's just not necessary. So just obviously you prescribe sensibly, but there is the opportunity to progress into that if that is something that you want to do, and a lot of health visitors have gone on to do that. That's also another bonus. So that's the uni side of it. Then practice. practice. You have a lovely workbook, similar to the one that you have during your nursing, like your training, and like you have to get things signed off, but it's a really big document, and there's assignments in it. I know every university does undergrad nursing in a different way, and there may have been assignments for placement as well, but this one, I don't know, it just really hurt my life. It really hurt my feelings. Like, yeah, it hurt. Anyway, we survived. Barely. Moving on. So yeah, that was practice. But yeah, these are going on simultaneously. So the same with nursing. It's like, imagine 3 years of nursing in 1 year. I'm not selling this very well, am I? No, okay. I think what I'm trying to do is be very realistic, so that if you go and do it, it's not that I made it sound airy-fairy. You may find it easier than what I'm saying, but I'm not trying to make it sound easy. You know what I'm saying? On a standard week where you split uni and placement, you are only doing 15 hours a week of university. Well, yeah, full day. So our days, well, my uni's course, it ran from 10 till 4 on a Thursday, and then 11 till 5. Was it 5 or 4? One of them. On a Friday. So not a full day, but it's a full day. Yeah, that was uni. Placement is 15 hours, so 9 to 5 usually is the standard working hours on the Monday and the Tuesday, unless you've negotiated differently. And then when you have your blocks of placement, so as I mentioned, semester 3 is full-time placement, so you are doing 37.5 weeks. That is not correct. 37.5 hours a week for 12 weeks, but you are also entitled to 2 weeks of annual leave during that time, so essentially it's 10 weeks. So yeah, that's what the hours are like. Currently, with COVID-19, obviously things have been a bit of a mess, because the nature of our role is to visit homes. Health visitor, we visit. But yes, we've not been able to do that. Well, my trust isn't doing that currently. We are doing remote working, so we're still completing the assessments that we do, but they're being done over the phone. Some of us are working from home, some of us are working from the office. Everybody's circumstances are slightly different, but yeah, we are still working, trying to keep things running as much as we can. Yeah, I think when it comes to, going back to when we were visiting, how many visits did I do a day? Ooh, it depends. So obviously you've got the flexibility in terms of you plan your own diary. Not so much in the training, because there's certain criteria you have to fit in before, like in order to pass. So as in, like for example, in the hospital, if you're learning to do cannulation, for example, you have to be supervised doing 10 cannulas before you're signed off to go and do cannulas as a, qualified cannulator. Is that even a word? I don't know. But yeah, so with health visiting, when you're training, obviously initially semester 1 and 2, initially you are shadowing your mentor or your practice teacher. You were initially shadowing them, and then after a while they start shadowing you, so you still go together, and then they will watch you carry out the assessments during the visits. And then once you get to semester 3, you will move away from your practice teacher and work in a different base. You'll be given a mentor, like a supervisor, and then you will be given allocated work, and you are expected to go out and do that work. If you have any problems, obviously you are allowed to ask questions and, you know, get another opinion if it's necessary, or, you know, those kind of things as you do as a student, but you are independently working. So during that time you are planning your own diary, you are calling and making your own arrangements for visits, that kind of thing. You will start to do that at the end of semester 2 as well, obviously to prepare you for semester 3, but yeah, semester 3 is when it kind of like officially hits that goodbye, we no longer want you with your teacher. But yes, in terms of how many visits you do a day, it varies. I mean, me personally, I haven't got the speed, should I say, in terms of, everybody always tells me it'll come with confidence, with time, all of those things, which I appreciate, and I'm sure it will, but it's initially, there's so many things that you cover in the assessments, and obviously as a new practitioner, or a new practitioner, you're practicing in a new field, you want to make sure you have covered everything. And sometimes for me, I probably overdo it, but then I feel like if I didn't do it, you know, you just feel uncomfortable, I didn't say blah. And so I'm a bit rigid in terms of, I have to do everything in the same order, I have to make sure I've told them everything, I have to make sure they understood it, I have to, so I'm really sorry for those parents who have had me as a health visitor and felt that I spoke too long. Forgive me, I'm new. But yeah, so it is something that comes with time, and that's what everybody says, and then you just learn to kind of have a conversation as opposed to doing a checklist, which does feel better when you can do that. But again, I think it depends on your personality as well. I'm not very good with small talk, so a lot of people, when I observe them, I'm like, oh, I wish I could do that. Like, they integrate the conversation into the assessment, and it all nicely, blends into one, which I really, really envy, because I can't do it. But I think I'm getting better. I won't lie, I won't put myself down too much. But yeah, it didn't come naturally for me, should I say. It's something that I have had to learn. But yeah, so because of that, I think I could comfortably hit 4 visits a day. However, there have been days where I've had 6, and I think the nature of the visit also determines the time you spend. So if it's a family you've seen before, chances are you'll be in and out quite quickly, because there's a lot of things you can cut out because you already know. If it's somebody you've never met, then it might be a little bit more time to kind of do a bit of introduction before you get to the point. But yeah, it does depend on the nature of the visits. Also the the reason for the assessment. So is it a new birth? Is it a 6-week? Is it a development? Sometimes with developments, as we know, children and babies, they don't do things on demand. So sometimes you can be not fighting, but like, play with the toy. Kids like, no, I'm not playing with you. And there's literally nothing you can do about it. And they're 2-year-olds, they're 1-year-olds. You can't really get angry about it. You just have to say, okay, it's fine. Most of the time, things you're asking, the parent can vouch for it anyway. But if not, you just come back and do it on another day, or you rearrange, or something else. You just improvise in the moment. So those kind of things can impact your day. Again, experience helps you to complete development assessments quicker. A lot of my colleagues say that they walk into a house, and before they've even started taking out their paper, they've done the paper so much they pretty much know what it's going to ask before they look at it. Whereas for me, I'm like, word for word, word for word, word for... But yeah, we're getting better. We are. But yeah, so those who can kind of look at the child and just be like, yep, passed. Like, they won't even take out the page. Obviously they'll still complete it, but they've done a visual assessment which helps them to go a bit quicker. But again, something that comes with experience. So yeah, it does take time. So the length of your visits may vary. Some of my colleagues can do 6, sometimes 7 visits a day. I have no idea how they do it, but they do it. And sometimes it is necessary because the workload is quite a lot. We try to keep continuity in terms of if you see a family or you see a mother antenatally, it's nice that if you can, you see them for the new birth, you see them for the 6 weeks. If possible, you see them for the development checks, just so that that family has got a familiar face, instead of, as we know in nursing in general, having a different person. If there's issues, you're explaining yourself over and over and over again, which is not nice for anybody. But sometimes it can't be avoided, but as much as we can, we do try and keep that continuity. Again, with the families where there's special needs, we do obviously allocate a specific health visitor for them, and obviously they will know the family, they will know, all the situations and everything, and they will follow it through and support that family as much as possible. So yeah, that's it really. So that's quite a lot of information. I hope I haven't bored you too much, but yeah, I hope it makes sense. If there's anything I've missed out or haven't explained properly, please do ask. I'm happy to clarify. I'm not an expert. This is just my experience and what I know, so please don't take anything I've said as gospel truth. Not that I've lied, but yeah, it's not something that I'm saying is this is the record sort of thing. Don't quote me. Yeah, do your own research, but yeah, by all means, I'm happy to answer any questions. Yeah, so I hope you enjoyed it. I hope you got the information you wanted. Like I said, if not, please ask again. And yeah, that's all from me. Thank you. Bye bye.